Good morning, everyone, and thank you for joining us today for this MCAN and Covering Wisconsin training. The title, as you see on the slide, is How to Spread the Word About New Lower Cost Coverage Options. So today we're going to be going through a series of slides just to share with you some information that is very timely right now, because for those of you who are familiar with the marketplace, we are in a special enrollment period. So I am Jenny Appleby with Covering Wisconsin. I will serve more as the moderator today. You are going to hear from a number of our guests as well, so they'll introduce themselves in a moment. For logistics, if you are attending this live, you will notice that as an attendee, you are muted. So if you do have a question, please go ahead and enter that into the chat box and we'll be monitoring that throughout. And then also what we can do after we stop the recording at the end is we could let everybody have the opportunity to unmute themselves. And so if you would like to ask a question at the end, you may do so. So why are we here today? So the purpose of this training was something that we've been brainstorming for a while. And it was a thing where we've had a lot of conversations with community partners and just thinking of what are some of these best practices? What are some things that we've learned? Where are areas that we still need to maybe continue to grow? So one of the things is that the first bullet point there you'll see is that we're going to really focus on this idea of partnerships with each other. We'll talk about what that term community mobilizers means in just a minute, but how do we best work together so that we are servicing consumers in Milwaukee County? Some of you might be outside of Milwaukee County, and that's fine. These tools and techniques apply to anybody, anywhere. But really, how do we make sure that consumers are able to sign up for and successfully get enrolled in insurance for which they're eligible? We're going to also, that bullet point number 2 is ways that we can work reciprocally. I didn't think of reading this through before out loud as we typed that word on the slide. But what I really mean by that is how can we work cooperatively with our partners? So one of the things that an example there is when we think about a health insurance navigator, so somebody that actually does appointments and helps people sign up, we're doing a lot of talking to partners in preparation for those appointments, because we know somebody's coming to us and they're not going to be eligible. So they're going to have to wait until this next time period, whatever it might be. How do we best make referrals to that other agency that's beyond enrollment assistance? And so as navigators, we learn a lot from our partners about what other community supports and what other programs are out there, because we're sitting there in appointments, sometimes an hour or more long with a consumer, and they don't just talk to us about health insurance. They talk to us about other things going on in their life. And so it's important, this training, yes, it might have a health insurance focus, but we want to know about what you do too. Maybe you do health insurance and maybe you focus on a different basic needs program or something like that. And then also that idea of the strong partnerships, helping make strong referrals. So of course I can Google and I can look online and I can, if somebody says they need help, with housing or something, I can look up resources, but to make a really strong referral would be helpful if I already know about that program. Or even better, if I know somebody in community advocates' housing department, if I have a direct warm handoff instead of just a general referral. And so we're going to talk about that today. How do we continue as these service providers to build our networks? And then also, okay, if COVID has taught us one thing, it's that we've had to be flexible. So how do we adjust our strategies? Going to the example of enrollment assistance, we were doing enrollment assistance almost exclusively in person, and we had to pivot and do it almost exclusively over the phone. How do we make those adjustments? One of the things to think about is not just in how we do our work, but how do we promote our work? How are we reaching people if we're not out there at as many community events as in the past? So we'll talk about some strategies that have been used, and we're going to use the HealthyMKE.com website as an example. So if you haven't been to that website yet, we'll at some point later in the presentation put it in the chat box, but really just looking at how that website was formed. That was the Milwaukee's Unified Emergency Operations Center, UEOC, kind of came together in the wake of COVID and said, okay, how do we better get information to people in Milwaukee County? And you'll see with HealthyMKE, just the whole spirit of that website and even the name of it being HealthyMKE is something that I think a lot of us can get behind, that we support a healthy Milwaukee. So with that intro, I will just quickly share with you the agenda. So I won't read it word for word, but you'll just kind of see what we're going to go through. We're going to start with the introductions and work through in that way. So with that, I'm going to turn it over to Courtney and Stephanie to do an intro of themselves and covering Wisconsin.
Hey, thanks, Jenny, and welcome everybody today. Thank you so much for joining us. We're really excited to meet you all and have this conversation. My name is Courtney Harris. I am the Outreach and Partner Development Manager at Covering Wisconsin and will be one of the two speakers today from Covering Wisconsin. Stephanie, do you want to introduce yourself too before I jump into kind of who we are?
To unmute it first. I'm Stephanie Sievers, and I am the Insurance Literacy and Communications Manager at Covering Wisconsin. And so for my part, I'll talk a lot about the promotional pieces that we have available and how to use them.
Thanks, Stephanie. So just a little bit about Covering Wisconsin and who we are for everybody on the call. Many of you are very familiar with Covering Wisconsin, but we are a nonprofit organization. We're housed at the University of Wisconsin, but we work statewide, and our mission is to help people in Wisconsin find and use health insurance coverage. And we do that in a number of different ways, primarily and most importantly, through direct consumer enrollment assistance. So we at Covering Wisconsin have been a navigator entity since 2014, since the Affordable Care Act marketplaces rolled out that year. And what that means is that we've been offering free in-person and virtual health insurance application and enrollment assistance statewide for healthcare.gov and Badger Care Plus since that time. So we have folks in the community throughout the state that are helping folks enroll and make sure they can effectively use their coverage. I'll talk a lot more about what that actually looks like later on. But we also, to Stephanie's point about health insurance literacy, also develop materials, health insurance educational materials and promotional and marketing materials, and train professionals and consumers on health insurance topics in Wisconsin and nationally. So one of the ways we do that is through working with our community partners and training them and helping them be familiar on these health insurance related topics and how to spread the word. So that's us, and I'll pass the baton on to Emken.
So I'm going to do just a brief overview of the Milwaukee Healthcare Partnership and the Milwaukee Enrollment Network. So you might have heard both of those. You can see the acronyms there on the screen. You'll definitely hear Milwaukee Enrollment Network called MCEN. But what's the Milwaukee Healthcare Partnership, kind of the driving force behind MCEN? So as you can see here, it is a public-private consortium dedicated to really improving the healthcare for people in Milwaukee County in a variety of ways. And so one of those ways is by convening the Milwaukee Enrollment Network. That's one of the projects from Milwaukee Healthcare Partnership. So MCEN is what is really that group focused on health insurance. And so we do that in a variety of ways. You can see the four main priority areas where a lot of the activities fit under those. So for example, this Enrollment Assister capacity building, those of you who are on the call and are Enrollment Assisters, this is the kind of thing that MCEN does, is doing training, supporting Enrollment Assisters in Milwaukee County. I do want to just take a quick moment to introduce, if you have not yet met him, Justin Rivas. I know he is on the call today, so maybe he'll take his video, put his video on. I can't see everybody at the same time and just give a quick wave, but he is the new Director of Community Health Initiatives for Milwaukee Healthcare Partnership. And as that position was evolving and growing and just created, one of the things is that MCEN is now going to be under Justin. And so Justin is now the manager and the director of the Milwaukee Enrollment Network. So we're very excited. He's been on board. I see his camera's on. I just don't see him on my little screen, but that, yeah, welcome Justin. And so you'll see his name at the very last slide. At any point in the training, he may chime in as well, but That is MCAN and Milwaukee Healthcare Partnership. And with that, we will turn it over to Aziz at Empower.
Good morning. Can you hear me okay?
We can.
All right. Well, yeah, my name is Aziz Abdullah. I've had the pleasure of working alongside both the Milwaukee Healthcare Partnership, MCAN, as well as covering Wisconsin during open enrollment last season, which turned into more of a year-long initiative this year in response to the special enrollment period. Our work predominantly focuses on education and marketing outreach in some of our most vulnerable communities in the Milwaukee market. And so not only do we try to be an ally, but bring community resources and community thoughts to the work that we do. So we're really excited to have an opportunity to share some of the ideas that we've been able to execute and hopefully, create an ecosystem in which we all can collaborate and share ideas. So thanks for having us.
All right, it's back to me, and I think Justin and I have the honor of competing for who's the newest member of this group. I'm not sure, I think it might be Justin, but with that in mind, I get the honor of kind of laying the groundwork here for our conversation today and defining some terms. So kind of setting the stage for the rest of the conversation. And then Aziz and Stephanie are gonna really take it over and talk through some examples and the how, and really some of the exciting examples and pieces that will help you understand why we're really here and why we do it, what we do, and how we do it later on. So just to kind of start us off with defining some terms, you've already heard us talk about enrollment assistance. Many of you on this call today are enrollment assisters, so you're very familiar with what we mean when we say that, but just for any community partners or others who are on, and this might be a newer concept, enrollment assistance takes a number of different forms, but at its very base, when it comes to health insurance, this is folks who are trained and licensed to provide free health insurance help. And I'll talk a little bit more about what that means. But there are a number of different types of enrollment assisters that you might hear. One is navigators, which I mentioned when I introduced covering Wisconsin. And what that means is that a navigator entity is someone who receives a grant from the federal government to have outreach and enrollment assistance around health insurance coverage as their primary function. So Covering Wisconsin has been functioning in that capacity since 2014, as I mentioned, and we have navigators in different areas of the state. But there are other types of enrollment assisters as well who are also trained and licensed to provide this help for free too. And those are folks like certified application counselors, financial counselors, agents and brokers, and especially folks like certified application counselors and financial counselors, maybe folks that have other roles in their organization, but also are trained and licensed to provide this health insurance related enrollment help. And what do enrollment assisters do? Enrollment assisters play this extremely essential function and really fill a lot of different roles when it comes to health insurance coverage. So they work directly with consumers and help folks find plans, health insurance plans, and financial help to afford those plans. And also help folks sign up for plans. Primarily, we talk about publicly available health insurance options like healthcare.gov or the marketplace, and then Badger Care Plus or Medicaid or the state health insurance programs. Some enrollment assisters also provide help with Medicare or other programs, but not all of them. And the great things about a lot of our enrollment assisters is they have these strong networks of partnerships. And so if an enrollment assister, for example, is not trained or licensed to provide Medicare assistance, they often have strong partnerships with ADRCs or other partners in the community who can help folks with that assistance too. But enrollment assisters really are available to provide answers to health insurance questions of any size and scope. So any consumer in the community who has a health insurance related question, whether that's they're already covered and they just have questions about how to use their insurance, how to get access to a provider and have them designated as a PCP, for example, or how to find a health insurance provider that's in their network, anything like that. But also kind of post-enrollment help Getting help with billing issues if you're running into an issue with your health insurance plan, or maybe need to appeal with a health insurance company. Enrollment assisters provide help with that whole spectrum of health insurance related issues. And most importantly, our in the community, members of the community have connections with folks locally, and really build strong relationships with their consumers, because health insurance is a really personal topic. People's health and healthcare are really personal needs. And so our navigators and enrollment assisters are compassionate providers of this type of assistance, and can help folks through this really complicated process of health insurance coverage. Now, how do you find an enrollment assister? In Milwaukee, we're really fortunate to have something called the Milwaukee Enrollment Directory, which is a Milwaukee-specific document that just focuses on enrollment assisters that provide assistance in the Milwaukee area. And this document is helpful because it may include folks who don't provide this assistance publicly. So maybe they work only with their own patients or members, or they provide assistance to the general public, and that information is designated in this directory. There also may be an indicator of the types of programs that an enrollment assister provides help with. So perhaps an enrollment assister is primarily focused on Medicaid and Badger care, or they provide help with a variety of programs. And so that directory will help you navigate that as well. And I see Jenny just put the link to that directory in the link for folks to check out too. You also can call 211 to find an enrollment assister, and that is in the Milwaukee area or statewide. We work closely with 211 to train them and make sure that they have an understanding of all the different types of enrollment assisters and how to make those referrals. And 211 is also just an easy number to remember, so you'll see that in a lot of our promotions. We also have a tool on our website, Covering Wisconsin's website at coveringwi.org/enroll, called the Connector tool, where folks can enter a zip code and search for an enrollment assister locally. And in many cases, also schedule an appointment online. So there are a number of different ways to find an enrollment assister. You also can reach out to Covering Wisconsin directly, and we'll have our phone number at the end, at the final slide as well. And mobilizers. So Jenny mentioned earlier that we would define community mobilizers, and this is really the meat of why we're here. So a mobilizer can be defined in a number of different ways, depending on the topic that you're speaking to, and who we're talking about. So in the context of health insurance coverage, we often think about an enrollment assistance. We often think of mobilizers as individuals or organizations who promote awareness about the need for and the value of securing health insurance coverage, but may not directly provide assistance to consumers with enrollment, and instead would make a referral to one of the enrollment assistance groups that we were just talking about. And then who a mobilizer can be also varies. So in some cases, a mobilizer may be an organization, a community-based organization or other type of organization. We see a couple of examples here, food pantries or shelters, or other local groups like community neighborhood centers, homeless shelters, things like this, but also could be individuals in the community. And the root of our mobilizer, and others may chime in and talk more about this later on too, is trust from my perspective. So a mobilizer is a trusted community-based individual or organization who already has relationships and connections and the knowledge of a community and what might resonate with them. So really importantly, we think about mobilizers as having insights into the community and what might speak to folks locally when it comes to something like health insurance coverage. So what types of messages, what types of messengers might speak to someone in the Milwaukee area as opposed to another area of the state, or a certain group of individuals as opposed to others. We know that one message and one messenger does not resonate with everybody across this state. So it's important that we work with individuals who have that trust and who have knowledge locally of what will really hit home with folks. All right, and then we'll talk a little bit more about mobilizers and kind of strategies for building partnerships with them later on. And Aziz and Stephanie will talk about some examples. But why are we here today? Why are we talking about this now? What are some of the key messages that we're trying to get out to consumers right now during the special enrollment period that Aziz mentioned? One major piece of this is because of the American Rescue Plan Act or the latest COVID relief bill that came out earlier this spring. So this latest COVID relief law made some really substantial changes in healthcare.gov that really changed the game for a lot of consumers in terms of affordability. And as Aziz mentioned, because of the COVID health emergency and the fact that we have these new opportunities and new options for folks, the marketplaces through healthcare.gov are open right now. So outside of the normal open enrollment period, folks have an additional opportunity right now to take advantage of these new options. So what did the American Rescue Plan Act change? It really made prices in healthcare.gov lower than we've seen so far in the past. This is the Biden administration's kind of first attempt at making these healthcare.gov marketplaces more accessible for more folks. And it did that in a number of ways. First, just by increasing financial help or lowering premiums for folks across income groups. And this applies to both new folks who may have not been covered in the past or may not have found something affordable in the marketplace and want to sign up new during this enrollment period, and folks who are already enrolled can come back to the marketplace and get these lower premiums. Really significantly for folks at the lower end of the income spectrum in the marketplace, so folks that make below 150% of the poverty level, which we have an example here for a family of 3 is about $32,580. There are now $0 plans available on the marketplaces for folks in that income range. And these are good quality plans, what are called silver plans, that also have additional cost savings to reduce what people have to pay when they go to see a healthcare provider and how much folks have to pay for healthcare services over the course of the year. It also, for the first time, made tax credits available for folks at the middle range of this income limit. So above 400% of the poverty level, or about $87,000 for a family of 3, by capping how much folks need to pay out of pocket for their premiums each month. So no one now will pay more than 8.5% of their income for a monthly premium in the marketplace. It also essentially just recently created extra subsidies for folks who have received unemployment benefits this year. So starting July 1st, if anyone has been approved to receive, or has gotten unemployment benefits at any time in 2021, their income is capped such that they can also qualify for $0 plans, those $0 plans that I mentioned with additional savings for out-of-pocket costs this year in the marketplaces. So for 2021, regardless of your income for the rest of the year, folks who have received unemployment benefits this year can qualify for those $0 plans. So because of all of this, we're really trying to spread the word and encourage consumers to look again, both come back to the marketplaces and update their information, or explore if there may be a better plan available for them now because of these changes, or for folks to take another look and consider signing up right now. So on that front, some of the key messages we'll talk about in a second, but covering Wisconsin, like I mentioned, we also provide health insurance literacy resources. So a lot of that information on health insurance coverage and who's eligible and the income limits and what changed in the American Rescue Plan is really detailed and complicated information. And we have resources that break down a lot of those concepts on our website in English and Spanish, both generally about health insurance coverage, how-to sheets, and also just about the American Rescue Plan Act and how that has changed the game in the marketplaces and what folks need to do, both current consumers and new consumers, and then how to find free local enrollment help. So what are the key messages that we're trying to get out right now around this special enrollment period and the American Rescue Plan Act? I'm not going to read through all of these because you have them on the screen, but the main point here is just that this is a really good opportunity right now. We need help spreading the word, and these are some kind of high level points, key messages, quick and easy ways to communicate some of that complicated policy information that I just shared, and that we're really going to be kind of incorporating into the mobilizer work that we're going to talk about later on in the presentation. So these are the key messages that we are hoping to get out to the community through our partnerships with mobilizer groups. Now, I'm going to transition it in a moment to Aziz and Stephanie to really talk about that how and some examples. But I just want to emphasize again that, you know, our mobilizer network and these partnerships are so essential because they have those trusted relationships in the community. They already know who's out there and how to find consumers and how to reach them with messages that will really resonate. And also, to Jenny's point earlier, these relationships are reciprocal. So a lot of times, mobilizers may be organizations that are doing this type of work because it's a part of their mission. You know, improving community health is a part of their mission. But also this may just be an individual or an organization who believes in this work, that wants to get involved and spread the message. And so we can equip folks with the tools and the strategies to help get out the word about health insurance in particular. But they don't need to be the experts because we're here and can make those referrals. And when we can, we do try to compensate mobilizers for this work because this is an extreme value that these trusted individuals and organizations are providing. So you'll see there are some examples. We try and provide financial compensation to folks when we can. And if we can't do that, the other way that we try and to build partnerships in this way is by making sure that that relationship is reciprocal. So if we are asking a mobilizer to spread an information about health insurance coverage, how can we also increase awareness of that individual or organization services in the community? How can we also make referrals to them for their services and their expertise? So with all that, I will hand it over to Aziz and Stephanie for the fun stuff.
And if I could interject real quick. So first of all, thank you for laying the groundwork and for giving us that brief policy overview. That's always really helpful. We did have a couple policy questions that came in. So I think maybe now addressing those before we move on would be a good flow.
Sure.
First one was, for those that have received unemployment anytime this year, will this extra savings assist consumers in the regular open enrollment in November?
That's a great question. And at this point, the answer to that question is no on the unemployment piece. That unemployment additional financial help is just for 2021 insurance plans. So for open enrollment that's coming up later this fall, that is for folks to enroll in plans for the 2022 plan year. And at this point, that additional financial assistance for unemployment in particular is not available for those plans. However, the other American Rescue Plan changes, so those additional subsidies that just increased financial help across the board, are still in place for 2022 and will impact consumers in open enrollment.
Okay. And then as to follow up with that, so this is again related to that unemployment piece. So individuals who received unemployment compensation in 2021 are eligible for zero cost insurance plans, correct?
Correct.
And then for how long will their plans be zero cost? For 1 year? Is it just for when we're in calendar year 2021?
That's right. That's just for calendar year 2021 for the unemployment benefits piece.
Okay. Thank you.
Mm-hmm.
All right. With that, we'll turn it over to Aziz.
Can you hear me again? Perfect. Okay. So again, our agency at Empower, we do the best job that we can as it relates to developing engaging content for the consumers and individuals that we're looking to reach. I think this is always a creative and collaborative space. We never come to the table as if we have all the answers, but really through ongoing conversations, both with community members and with our partners, attempt to develop strategies and messages that ultimately will resonate with the audiences that we're looking to serve, and really make sure that they have the information and resources that they're looking for. I think the thing to note is the fact that when we talk about how messages are disseminated within community and how people make decisions, specifically, around behavior, one of the things that was elevated originally was around trusted voices. And I think those trusted voices come through a number of different channels. And so, and Justin, I'll answer your question one second. I seen it pop up. But with that, so I think the thing to acknowledge here is the fact that consistency, frequency, and channels of messages are really important to diversify when we think about leveraging how we reach our audience. So one being social and digital, print, collateral, radio, print media, and outdoor. The thing to really identify is the fact that our goal, especially over the last OE and some of the closing promotion around this special open enrollment period, is that there's some people who get their information from, let's just say, their grandmother. And so their grandmother may pick up the newspaper at a grocery store. And so it's important that we resonate the message, even though we may feel that she may be covered because she has a level of influence and is a trusted voice within her family. Making sure that she's equipped with some of the basic information is one of the ways that we think about the work that we do. Additionally, we know younger people have been a harder audience to reach. And so this year we were really saturated and consistent within social media. And on this next slide, we'll talk about how we leverage social media, not so that it was just static content, but also that we had the ability to have local voices that were able to be resonated within that content. For Justin's question, when we talk about and characterize audience, I think we look at what, as I've been identified, is considered around movable middle, or individuals most likely to respond to our messages based on the outreach that we're doing. And so we really categorize that in two audiences over this last year, especially during this special enrollment period as well. The first being individuals who may qualify, but just previously have not thought that they did. And so a lot of our messages were really resonating around things like 9 out of 10 people may qualify, or take a moment just to see if you could qualify, because there's a lot of individuals who may qualify for some of these additional benefits, but just because of previous years and the way this is a ever-changing landscape, making sure that individuals ongoingly consistently are reminded that they may have the opportunity to qualify was the first. The second were individuals that traditionally have not had coverage. And so again, this is always something that we try to advocate and move forward within the communities that we serve. And predominantly this year, we focused on our vulnerable populations. These were individuals that were in both zip codes that were underrepresented from a coverage standpoint, and just through census tract data that we had as well. But we also wanted to focus on individuals just understanding that this is an investment for you, and this is an investment for your life. And so leveraging kind of the ecosystem that we're in, the pandemic, I think health as a conversation has become a priority for a lot of new individuals. We just held a panel discussion this last week where a prominent journalist in our community says he and a group of his friends get together every month now just to talk about health concerns amongst themselves. And so it was not something that they had previously done, but really advocating and empowering individuals to have self-agency around the personal investment, and helping understand that insurance is really the key and the access that you need need to be able to access healthcare within our community. And so that personal investment is something that we also leverage, in addition to the fact that over the last year, a lot of racial justice conversations took place on a national scale. And so, you know, there was a movement that really used the language matter. And so a lot of our language last year even was around the fact that you matter. And because you matter, having healthcare coverage is something that needs to be a part of your overall investment of demonstrating that you matter. So those are just some of the examples. I think we could go to the next slide. So this is an example of how we resonated some of those messages. So when we think about mobilizers, I think we think about it in what I would consider to be a on the ground grassroots way. So you may work within a church network of individuals who volunteer, and they may have a health committee. And those individuals, as mentioned, they will collaborate with you, ask for materials, and make sure that within their congregation and within some of their church networks, that they have the ability to disseminate some of that information, whether it be within their leaflets or just ongoing promotions, allowing to be able to put up posters. But I think we also think about mobilization now as well, especially over this last year, is how can mobilization be converted digitally? And the way to do that is through influencers. And so on the right side of your screen right now, you see, you know, a really diverse group of individuals from an age and social status perspective. So in the bottom middle corner, you have the Alderman Khalif Rainey. Bottom right, you have State Representative Kaylin Haywood. You have a lot of different individuals that we were able to just have an open session one day at our studio, get individuals to come in and share those messages. I also understand that everyone may not have the capacity to record or produce, but the other thing is this, even for this period, we have individuals who just use selfie videos. And so, for example, just allowing community members who have a following, who have a authentic voice, really being able to share, you know, I went onto this website, I found an insurance navigator, and I'm just encouraging you all to take 2 to 3 minutes to just go on there and do what's best for you. So having individuals be those trusted voices is a form also of mobilization, and sharing why they feel like the investment of making sure that you have health coverage is important just through their voice. So it's important to identify like what examples or what relationships do you already have in the market, and how can you empower individuals who you have relationships with. So if there's a community organization who you annually partner with to do some promotion where they allow you to set up a table at an event, those are things that we want to continue to do. But in addition, a lot of individual organizations have their own social media. So maybe it's having some of their staff members or some of the individuals who you have worked with previously create a short video, because again, the more we put these messages out, the more collaborative we can be in this space. Ultimately, the overall goal that we're working towards of getting individuals coverage can be reached. And then I think the one of the fortunate opportunities we had over this last year was to be able to collaborate with the Milwaukee Healthcare Partnership and the UEOC to develop a website called HealthyMKE.com. HealthyMKE has been an evolving website, but really it's been a mantra and an initiative to really focus on very core priority issues that are driven previously through the initiatives of the UEOC, and as we move forward, really led by the members and the Milwaukee Healthcare Partnership. But one of the priorities, as we all know, during the pandemic has been this special enrollment period. And so when we looked at this website, this was somewhat of a digital representation of how we could create collaboration online. So it was not one entity that really led with this effort. It was not one organization that moved this forward. What it really was organizations who came together, who said, at the end of the day, our goal is to make sure that we can move forward and get back to the healthiest of Milwaukee and continue to move forward with that. And so HealthyMKE has not only been a website and a shared resource of aggregation of information, meaning our goal was not to duplicate or replicate what existing websites and resources had in place, but to make sure that we could be stewards against some of the infodemic, over messaging to individuals, to coming up with consistent messages that we could all collaborate around. And so I think that the key thing that this represents is the importance of collaboration, and how when we all have a common and shared goal, you can have co-branded materials. So, Covering Wisconsin as well as HealthyMK, we both have materials that can be downloaded where you can add your logo to it. And so really, how do we continue to work collaboratively and together to make sure that the pieces of the lift that you don't have to do can be in a shared resource such as HealthyMK, but that you also have the ability to do sometimes what you do best and go out and engage and interact with other organizations. So again, enrollment information is available here, and we also will have some materials that are available not only through the website, but I think the next slide, which is the podcast. Perfect. So I think this is the last piece that we're sharing today, which is really how do we socialize health insurance coverage in meeting people where they're at on an ongoing basis. So, today I have on the Bucks hat. We talk about the Bucks consistently during the playoffs. We talk about food. We talk about entertainment, engaging with one another. There's podcasts, there's radio shows related to all of these day-to-day lifestyle behaviors. How do we start to create those same content and use those same methodologies for things that are just as important, but have not always been socialized in that same format? And so over this last, I would say 60 to 90 days, both Justin Rivas, the Milwaukee Healthcare Partnership members, and other collaborators have worked with one of our team members here at Empower, Imani, to produce podcasts. And it really allowed for the opportunity, both in English and Spanish, for individuals to be able to share from their personal perspective, both stories, reasons why individuals have prioritized coverage, and really helping walk through the experience in some granular detail, some broader perspectives on not only the importance, but how to get coverage, what the process is like, and lowering some of maybe the potential resistance or hesitation around time investment, difficulty, and really just socializing it in a way that individuals may be used to consuming information. And so the show is called What We've Got You Covered. Some of the examples that we've been able to use is how to partner with your provider rather than just go and, be a client, but how to give individuals self-agency as they go in, and how health insurance actually plays into that. So those roll out this month, and again, really excited to be able to collaborate. These are also able to be shared within your own networks if you feel that one of them speak to a specific issue that you feel like you want to share with your networks. And those instructions will be on the page that those live on, and we'll be able to share that through MKIN's listserv. I think I will hand it back to Stephanie, if I'm not mistaken. You're on mute, Stephanie.
Thanks. If I could just add to something that Aziz mentioned about influencer videos. If you have people or yourselves in the community who want to create those, I know Covering Wisconsin has been searching for stories to record. Sometimes it's hard to have people volunteer to share their story. And so if you've got stories, community stories, anything that really shows the importance of having health insurance, or how easy it was, or how it was life-saving, anything like that, we would love to help you record those. So, and I know Empower sometimes has also the capacity to do that as well. So reach out, we're here, and we'd love to hear your story. Okay, so I wanted to talk about how Covering Wisconsin worked with partners and mobilizers during the last open enrollment period. We had a unique opportunity where we had some extra funds where we were able to provide what we call seed grants. And so these were small pots of money to mobilizer agencies. And we worked with 11 mobilizer agencies who collectively serve 24 counties. And we were able to train 126 professionals from both these agencies and some of their partners who they thought would really benefit from some of the information that was provided in the training. So we were able, instead of just working specifically with Milwaukee, we were able to work with different agencies statewide. And so this for us was really a trial to see how this would go, how it could look. And something that was mentioned before, you know, community agencies know their populace best. They know their communities best. So what we had a template call of what we were looking for. And then each agency was able to fill in what they thought they could do and would best work with their audience. And so we got some really, really interesting proposals. So I'm going to talk a little bit about that in the next slide. So the mobilizers were able to use some more traditional ways of reaching people with print collateral, you know, phone calls, emails, some newer ones such as text, and different education or referral type activities. So with those 11 mobilizers, we were really, really happy with how many people we were able to reach. And this is not handing out a card to a random person at an event. This is a trusted community organization sending or giving information to their members in a more meaningful way. And so as you can see with the numbers, so flyers or outreach cards that were distributed was over 8,000. There were mailers, like postcards that were sent out, and these were all co-branded. There were magnets that were distributed. That was one of the creative ways that one organization chose to go. There were consumer phone calls to remind people, hey, it's open enrollment and you might need health insurance. Consumer text messages, emails, you know, well over 4,000. And then consumer conversations, these were more the one-on-one or small groups sort of educational setting. There were over 1,500 moments where people were able to give some one-on-one or more personalized referral type information. And then some agencies actually reached out to their partners because they thought the content and information was so important and they might want to know and share with their members. So that was 191 different agencies reached. And so we were really, really happy with how this went. And one of the things that we learned is the importance of providing that collateral, that those creative pieces that could be altered or changed a little to best serve different audiences. So we can provide sort of a template. Here's our design. Here's some different images. Here's a message. And then each agency can tweak it to fit their audience. And so that's really, really helpful because a lot of different agencies don't necessarily have the capacity to create their own materials. So some of the unique strategies that came from these proposals and were executed in a really, really interesting way where some of the organizations worked particularly with Spanish or Hmong speaking audiences. And so 2 different agencies created videos in Spanish or Hmong, and then those were posted on YouTube and Facebook. One organization that serves a real rural audience, they were posting them on TV screens in community spaces or local grocery stores that serve a particular audience. So one of the examples they gave is a grocery store that serves a Spanish-speaking community. And so they were able to put that message in Spanish in that grocery store on a screen. So that was a really unique way to get the word out. And we thought that was pretty exciting. So another unique strategy was including those key messages about enrollment in virtual training. So because, we were, it was last open enrollment, we were all pretty much on lockdown. Some organizations were doing Zoom trainings. For one example is a group called Connections. They serve young adult populations in Dane County, the Madison area, for underserved youth populations. And they included messages about health insurance, the importance of it, and open enrollment in their Zoom trainings. Other community members did professional trainings. One group, the Catholic Multicultural, I can't remember the exact name, but the Catholic Multicultural Agency here in Dane County, they have a legal representation that they provide in the community, and their trained professional was able to take messages about public charge and different immigration policies that were affecting people's enrollment and benefits, and bring that to a training that was for lawyers across the state to get out the word, to not tell people to drop benefits in certain cases. And so, you know, that was a really creative, great, fantastic way to spread the word. A different organization they have community health liaisons. And so they were going out into the community, sometimes just door to door with community members to conduct education and engagements and conversations about health insurance. And they actually trained a couple of their staff to really to be CACs and to be experts in this content, because they really valued the importance of the information for their community. And another creative strategy that we thought was really great was a couple agencies actually added some health insurance access questions on their agency intake forms. And that was both for adults and children. So one example is it was one group who works with immigrants, and they realized that a lot of their adult immigrant population may not qualify for Badger Care Plus, but a lot of the children did. And so being able to include some of those questions so that they could do better outreach to make sure that whoever can be covered is covered in the household. Okay, so one of the things that we asked groups to do was to share our social media posts, or we had social media posts in our toolkit that they could personalize and share on their own. And I just wanted to give an example of how this is so important, and to really piggyback on what Jenny was saying about how, you know, we're in a shared space and we need to help each other get the word out. So in this first post, we post a lot. So in this first one, it didn't reach very many people. It was not a terrible post. I mean, it reached 327 people, but that was only shared 4 times. So the lack of shares really shows you why it didn't reach more than a few hundred people. The second one was shared 15 times. And you can see that it really increased the reach of how many people might have seen that message. And many of those shares were other community organizations. And then this last one was shared really, really well with some smaller community organizations that are really active in small community spaces. And it was shared 21 times, but wow, it reached over 2,400 people. So by just following our partner agencies on our social media platforms and sharing their content, we can really help each other get the word out. And, you know, Covering Wisconsin, we often will boost our more popular posts. And the more shares and the more reach and the more engagement I have on a post before I spend money to boost it, the much larger audience I'm going to reach in the boost. You know, if I boost that first one that only had 4 shares and only reached 327 people, I'm not going to reach very many people. Maybe I boost it for 30, 40, 50 bucks, maybe $100, but I'm still not going to reach very many people because it just wasn't a very successful post. Whereas if I boost that last one, I'm gonna maybe reach over 10,000 people in my boost. So it just really shows how important it is that we really are reciprocating on social media. Okay, so one of the things we learned that was of vital importance is that we need a toolkit. We need a toolkit for partners who may be also Enrollment Assister agencies, and we need a toolkit for other partners who maybe are not doing this work, but are happy to share the message. So our toolkit can be co-branded, and in many cases, we can help you change the message to be a little bit more appropriate for your community. So I'm going to show you, if you could, I'm gonna have to, if you could stop sharing the PowerPoint, I'm gonna show the toolkit. Just give me a minute here. Okay, so this is the toolkit. It's available online. All of these resources that we have posted are in Google Docs. So when you click on them, it goes to Google Docs. I know some agencies might block Google Docs. If you have any problems, email us. We're trying to continually try to find better ways of storing all this content where it's more accessible. So let us know. But as you can see, first of all, if you notice at the very top, there's the En Español button, and that will take you to all of the same material, but in Spanish. Okay, so first we have our social media posts. So all you do is find the one you like, you click on it, and then you can download it straight from this storage site, which is via Google Docs. Oh man, now it's covering up the. Sorry. Okay, and then if you scroll down, we have outreach cards. These print, I can't remember the exact dimensions, but they're a small card and they have a front and a back. So just to give you an example, when you go into this folder, you'll have the front and back side. Now we have information about us on the back side, but with other Enrollment Assister agencies, we can put your information on the back side. So that is something that we can do, and your contact information. So in those cases, it's best to reach out to Courtney. I'm struggling because the Zoom control bar covers up my tabs at the top. So then we have flyers, and these are flyers that are on 8.5 by 11 pieces of paper that you can print out and share in the community. If you want a larger size, we can also do that. So it's very, very easy for us to reformat this to print into a larger poster size. And then here's the ARPA handout that we had discussed earlier. We also have information about public charge, really just trying to get the word out that using benefits will not hurt your immigration status. Some policies have changed. And also we have information about the texting tool. If people are hesitant to use any type of public benefit, there is a texting tool that's available. Just to show you. This is available in flyer and social media formats as well. So here you have information about a texting tool. You can use phone, WhatsApp, or it's also available in web chat for people who want to check in about their particular status or a family member's particular status, and if using a benefit might hurt them. Okay, that is the toolkit. And if there are no questions, I think we can go back to the presentation. And we update that toolkit for every season, for lack of a better word. So right now we're in the special enrollment period that is ends in August 15th. So all of these great deals that were talked about at the beginning, people can still sign up for those until August 15th. And so after that date, we will update it with open enrollment materials so that people can get the word out in advance of open enrollment. Okay, so a few other items here. If you're looking for content, you can also just follow us on social media. We have we post a lot of GIFs and videos. I couldn't get the GIF to play here, but this last one about the explosive savings was a little rocket and then fireworks go off. Some of those influencer videos that Aziz presented on, they are available on the MCAN Facebook page, and this has a link to that here. Covering Wisconsin posts regularly, often every day, but certainly every week on both Facebook and Twitter. And then also, if you go onto our website and you decide to post one of the social media posts, it's great if you tag us. You know, the more you tag other people, the more we can also share your posts, and our followers can see your posts, and the more viral our messages can be. So you want to go to the next slide? All right. So the key takeaways and action items are: get creative, you know, let's help each other, and you can adapt materials using Toolkit resources. Covering Wisconsin is not the only group that has Toolkit resources. OCI also does, and maybe Jenny can put that link in the chat. Sorry to put her on the spot. And those are all Wisconsin specific messaging. So the other, you know, share key messages on websites, in newsletters. You could send text or email messages. Covering Wisconsin does have templates that we can share that even have, you know, images and whatnot in them to make it easy for you. You could host an event and we can assist with that. You could incorporate health insurance into conversations about other services or supports that your organization offers, such as I said before that one organization, a couple of them incorporate it into their intake forms. And you know what? We want to know about your work too. The more we know about each other and the community supports that are out there, the better we can help each other help the community. Okay. And oops, there we go. I'll let Jenny talk now.
Yeah, thank you, Stephanie. I think one of the things that was so helpful for me to hear even for this training is just the ways to be creative. There is no one way to spread the word about health insurance, to spread the words about the other programs. I love the idea of, okay, leveraging places we know people are, like social media. Tag us, we'll tag you, follow us, we'll follow you. Just kind of how do we best reach our consumers for what they're looking for at the time. And also that, you know, you don't have to say, okay, go to Covering Wisconsin. If you do enrollment assistance at your organization, let's tailor materials so that we're sending people to your department, things like that. So definitely, this doesn't need to be the last conversation about these kinds of things and these strategies. So feel free to reach out. Before I go to the contact information on the next slide, I am just going to draw your attention that if you could please complete an evaluation. We really appreciate just your feedback on how today's training went. Let us know. And so if we do things like this moving forward, what could we change or tailor or tweak? So with that, on the screen, what we decided to do is kind of give you two main points of contact. You're obviously welcome to reach out to any of us, but the main contacts we're going to put here, one for Covering Wisconsin and then one for Milwaukee Healthcare Partnership and MCAN. And then let's see, we did have a question that came in, and for the rest of you as well, feel free to enter your questions in the chat box. But do you have a list of free clinics in the 6-county area? So and I think I'm wondering if they're talking about, are you talking about southeastern Wisconsin here? And Courtney is going to put the list of free and low cost clinics here. I can send that out to everybody.
And that's the statewide kind of find a free clinic resource from the Wisconsin Association of Free and Charitable Clinics.
Mm-hmm. And I think that's a perfect example of, okay, what do we need? What do we need as enrollment assistants? I think free clinics is something that comes up a lot. And so thank you for asking that. And then yes, also definitely the safety net directory when we're looking specifically for Milwaukee County. So we'll put that in the chat as well. So if you haven't seen it before, there is the Milwaukee Healthcare Partnership does the safety net directory then. And with that,
Jenny, there was a question about getting the presentation and where it will be available.
okay, so what we'll do, kind of a format we've done for a lot of our other presentations, is after this session, if you are attending live, we will go ahead and send a follow-up email to everybody who attended today. We'll send you a link to the recording, the slide deck, and then probably a link to the survey, but the eval, at the end here. If you are listening to a recorded version, I would encourage you at the very end here, you saw the Covering Wisconsin contact info, reach out to us if you're watching this, months from now.
I also just, while we're on this slide, just want to echo that if you have questions and you want to just talk more about what we talked about today, what it looks like to partner, want to learn more about the toolkits and how you can tailor materials, definitely please reach out to me or Justin, and we'd love to have more conversation with you.
And with that, I think we can conclude the recording, and those of you live, we will give you an opportunity to unmute yourself if you'd like to verbalize your question.